If patients are having symptoms such as clicking, locking, or jamming when moving the elbow, this often requires surgery to remove the loose bodies within the joint that can be caused by arthritis that cause these clicking and jamming symptoms. This is a pretty quick procedure, can be often done awake under regional anesthesia, and patients can be back to activity very quickly with postoperative rehabilitation. If there's more severe restriction of movement due to the arthritis, then keyhole surgical removal of the extra bone formed by arthritis and releasing the tight capsular structures around the elbow can help patients regain activity in terms of range of motion. This procedure, it can be done awake, again through keyhole surgery, but needs aggressive post-op physiotherapy to prevent stiffness from recurring due to scarring. And patients could expect to start using the arm as soon as possible and hopefully be back to a full level of activity within about 3 months. As this is a degenerative process, however, they're always warned that their arthritis may deteriorate over time. So the benefits of surgery for arthritic procedures in terms of keyhole surgery may be short-lived, but this can be up to several years, buying patients important time to continue working and continue their recreational activities.